Welcome back to yet another episode of SYNLAB podcast. It's amazing to have you here. My name is still Patsy Mokungah and I'm your host. With me here today, as we have been doing, is Professor Fasanmade and Dr. Okunowo. And we've been discussing about how to maintain your thyroid health. In this episode, we're going to be delving into lifestyle habits for a healthy thyroid. So my first question is exercise. Some people like hearing exercise, gym rats, as they call them. Some people don't like hearing exercise. People that like to sleep, like me. Yeah. How does regular exercise benefit thyroid health?
Yeah, thank you again for having us. Exercise is like a broad spectrum, good lifestyle measure, meaning that no matter the condition you think about, exercise has a positive vibe on it. So when it comes to the thyroid gland, people that exercise well, number one, they are reducing their stress. And also they are helping the metabolism of almost all the body. And also they put less pressure on the thyroid gland. So exercise helps because exercise encourages healthy function of all the organs, including the thyroid gland. And it reduces stress.
Just all kinds of exercise. There's no particular one. You won't say jogging helps more than, I don't know.
Well,
boxing.
The easiest exercise that doesn't need any equipment or any gym subscription and is safest for everybody is just to walk. Because when we say jogging is not suitable for everybody. If you have arthritis, you can jog. If you are old or frail, you can't jog. And jogging is not something you can do within your sitting room. Yeah. But you can walk in your sitting room, you can walk in your compound. So that's why we say walking is safest. And I don't think many people have gotten injured from walking. But if you jog, you might trip. And so that's the reason why walking is always the best exercise for any medical condition.
I think it's important to mention because you might think that walking is just something everybody does, but not a lot of people are more sedentary than they think. If you even think about we're in Lagos, I don't think Lagos is a walking city. Because a few weeks ago this conversation came up about, I think people were talking about going from Yaba to somewhere else, and it's like a 15-minute walk. But the average Nigerian will take a bus.
Exactly.
Yes.
So we should walk more.
We should walk more.
Me too, Ashua.
Yes.
Amen. But you mentioned stress. What impact does stress have on the thyroid gland?
Well, the thyroid gland, because it regulates your metabolism and your metabolic rate, stress has an effect on it, and it has an effect on stress. So they feed back to each other, meaning that a person who is under a lot of stress is going to be overworking his thyroid.
Because metabolism is slow.
Yes.
Stress slows down your metabolism or
stress makes it faster. Yes.
Increases it.
So both of them feed back into each other. If you have a thyroid gland that is working overtime, it's going to lead to stress. If you have stress that is too much, it's going to lead to some degree of thyroid dysfunction.
So we really need to be avoiding stress. Can you avoid stress in Lagos? just thinking. So, okay, the next question. How does sleep affect your thyroid gland?
So I will say that people with thyroid problems have sleep disorders. Yes. So the sleep disorder depends on the type of thyroid problem they have. Earlier in the episode, we've been talking about thyroid problem can be majorly divided into two. Those with having overproduction of the hormone, which is called hyperthyroidism. Those that have underproduction of the hormone, which is called hypothyroidism. So now, those with hyperthyroidism can have the sleep disorder called insomnia. They find it difficult to sleep because their body is on the high metabolic rate. They feel like working all the time. They feel like being on the computer, jogging, moving around, doing one thing or the other.
They are restless.
Which is funny because sometimes you see energetic individuals and you want to be like them. Meanwhile,
so
that person might have thyroid issues.
They are very restless. So to lie down and sleep is difficult for them. So they have a lot of sleep issues. with hyperthyroidism. So now looking at the hypothyroidism, most times when you see something in hyperthyroidism, hypo is an opposite of hyper.
So they sleep more.
So they sleep more. You wake them up, they'll say, no, leave me on bed. I want to
sleep a little
continue
bit.
sleeping. So that's just the pattern.
But
what
are
they
there
have.
sleep techniques that can help you? Maybe if you're not sleeping enough due to your thyroid problems, are there sleep techniques that you can advise to help somebody sleep better or get out of bed?
So the issue is those with hyperthyroidism, they have problems sleeping. When they present to the clinicians, there are some drugs we give them that helps calm them centrally and cool them to allow them sleep. So there are things we do to manage because it's happening from the level of the hormone disorder. So most times you want to give some drugs to interfere with that function and help them sleep.
Okay.
So, but those with hypothyroidism that sleeps excessively, one of the major way of helping them is to correct the hormone dysfunction and return it back to normal so that they can regain their
so you can't give
excessive-
them, what do you call all this, like stimulants, like coffee or...
Well, coffee won't really help because already their metabolism is
low.
sluggish, and if the problem is due to a low thyroid hormone, the typical physician or endocrinologist, usually what they do is that if they can't find out why the hormone levels are low, they will give the person tablets that contain those hormones, and that helps a lot. You mentioned other lifestyle things that can affect sleep. Well, they apply to people generally. If a person who doesn't even have a thyroid disorder wants to sleep better, one of the first things we tell them is that when you've had your dinner, which should be a little bit early, 7, 8 p.m., try to start to wind down, meaning that you can't be on your laptop, on your phone, and then have all the bright lights in your bedroom and think you'll be able to sleep. Or have music blaring in the bedroom and you want to sleep. If you want to sleep, everything you should put in a way that you're tuning off.
Yes.
The lights are low, or you're not using white bright light.
Yes.
Your phone, the illumination is much less. Your books and laptops, you put them aside. If you must play music, play cool music.
Okay.
Have a cold shower too. Have a cold shower.
In this
and
age
a light
of
music.
technology, it's hard. It's hard to put your phone down. It's hard to... Okay. I believe everybody, we are listening. Me too. So what environmental toxins can harm the thyroid? And how can individuals reduce exposure to these toxins?
Well, there are several things that affect the thyroid. And we mentioned, my colleague mentioned food that you eat, for instance, that reduces the hormones or causes coitus. So there are some agents in the environment that can also lead to a dysfunction of the thyroid. Some of them are chemicals, some of them are food, some of them are drugs. Some of them are pollutants, so there are different ones. For instance, for the food, we've mentioned the person taking too much spinach, too much strawberry, too much kelp, yes, too much cabbage, too much yam, too much cassava, cauliflower. Those are foods that will cause some problem with your thyroid function. In terms of medicine, the commonest one is cough syrup. If you're taking too much cough syrup,
I'm just glad you didn't say paracetamol. For cough syrup too.
Yes, if you take a lot of cough syrup.
I know people who drink cough syrup like without measurement.
Without prescription, yes. Have you just go
take
and drink? Yes.
And finish.
Yes, like once, and they say it works more
Yes,
down.
such people are going to have thyroid problems if they continue that bad habit.
I know who I'm going to call after this podcast. Okay, so just avoiding those kind of things.
Then
really
other
help.
things are not things you commonly encounter. For instance, if you are giving radioactive radio contrast dyes, when people go for some procedures, some types of scans, they can inject into you some dyes so that when they take a picture of your heart, they can see it clearly. Some of those contrast media or the chemical media that color up the screen some of them can cause a thyroid disorder.
Yeah, but that's now like medical. How
Yeah, that's why I said it's not something that everybody will come in contact with,
Exactly.
except maybe if you are where they are manufacturing
Yes.
that type of thing, and it's
then you should-
and then you get exposed to it too frequently.
Oh, this is very, very, very enlightening,
Yeah.
very interesting. So, one last thing I'd like to ask is, if we talked about sleep and oversleeping or sleeping less,
Yeah.
if you find that you are not able to sleep or you are sleeping too much, do you think that's enough reason to go and get your thyroid checked?
Yes.
Very true.
Yes.
Oh, that's very interesting.
Those are the symptoms,
Those are the
Those
symptoms.
are the symptoms you can have if you are oversleeping in hypothyroidism or hyperthyroid. So you need to just check yourself to be sure you're fine.
All
Yes.
right, I'd like to let our audience know, because I know they've heard a lot, they've learned a lot, and they know right now how lifestyle choices impact your thyroid health. And I'd like you to know that you can also walk into any location of SYNLAB Nigeria and request for tests relating to your thyroid. We are here to help you, and this is why we have this podcast, which you should by now have liked. But if you haven't, don't worry. This is a good time to like, to comment, share, tell everybody around about it, and make sure that they also subscribe. Don't be selfish. Tell your friends and family. We'll be back. Keep watching. Stay seated. We'll be back with yet another episode talking about how to maintain your thyroid health.